Hello, my name is Casey. This is my very first video response, and it's to the question of the day about ADHD medication. It is a topic I feel very strongly about. I was diagnosed with ADHD around 10 years ago. I guess you could say I'm currently just living with it. Now, I don't take any medication for it. I've been pill-free for a few years now. And when I started out, I was in elementary school, and I wasn't a kid that bounced around the walls and stuff. I was very chatty, like I am now, and I just couldn't concentrate in school, and so they said I have ADD, and they gave me Ritalin. As the year progressed, essentially, they figured out I had ADHD. Just wasn't a very hyperactive kid physically, but otherwise, yes. And with Ritalin, it worked really well. I was doing way better in school. I guess this would be the only time that the school helped a little bit just to keep me out of trouble. But the only downside was that I had to take a blood test every few months because it could be bad for your liver. It was pretty bad, and I was very small, so I actually had to take the pill twice a day, as opposed to a relative of mine who had to only take it once a day. So I was very small for my age, and they told my mom that this would continue if I just kept on with the medication. So she decided if I didn't really have to do this, she wasn't going to make me go through it. So she stopped at the blood test, and we got onto a new medication called Strattera. It was new at the time, so there hadn't been any side effects that they knew of. And they would advertise it on TV and be like, "Yay, everything's perfectly normal. Because you're not a normal kid if you have ADHD, I guess." And they would say on the thing that there were no side effects, so we didn't think anything of it. I would go to school, and I would have to take this pill every single day, because with this one you had to take it every day, even on the days you weren't at school, even on the weekends and during your vacation, so that it would still work. It made me sick. I always felt really sick when I took it. The only way I could fix that is if I ate something cold, and it was just not fun. I just hated that medication, so I stopped taking it. Simply did not want to do, so I didn't take it. My grades slipped horribly, and I would talk to the doctor. I would tell him, "Hey, I'm sick. It makes me sick, And they're like, "Maybe it's because of the pill, because of the pill size. Because when I took Ritalin, it was like a little itty bitty pill, and then with Strattera, it was kind of like that big in comparison. I wasn't used to swallowing pills, and they just kept making up all these really bad excuses when, in point blank, it was making me sick. It turns out later that it actually did have a long list of side effects, depression included, and so I dodged that bullet, I guess, if I continued it, because it was only 2 years. So once I got into high school, I started on Mendadate. And Mendadate was a lot like Ritalin. The pill was bigger, but it wasn't a big deal because it worked just as well. It didn't make me sick. I just went on with it, but I would forget to take the pill. And so you could see when I wasn't, because my grades it was I was pretty good, and then just steady, and then bam, bad. So after that, I just kind of just stopped taking them, because there wasn't a point if I just kept forgetting to take them. And just eventually, stopped taking them altogether, and, going to college, I don't take them anymore. But I think a lot of pills can be avoided. I mean, I know it's overdiagnosed. Even kids who don't have ADHD get diagnosed with it, so, most people don't really think it matters. it does exist, but because of the bad press, it's not really getting treated right. With me, I had to go into psychiatrist's office, and with the pills, like when we change pills or something, they would ask essentially how well it worked. And I've heard other people talk about how they didn't really go to doctors, so I mean, you should. Like, they should be asking you questions about it and how well it works, how it makes you feel, how, like, if it's making you sick or something. I think that some things can be fixed because some people have a different, a higher or lower level of it, if I'm saying that right. Where if it's really, really bad, some people, even as adults, can't function without pills. So, I mean, I can understand that. But I think for some, you can just sit down, you can kind of like show them a way, and eventually they'll just kind of follow that path better, and maybe they'll be able to live without pills. It doesn't mean that they still won't need help as they get older, but it's a start. So that is my video response. It's running very long. I'm really sorry if anybody's still watching this. Actually, thank you very much. That is my rant/experience about ADHD. So thank you very much, and I am out.